take leaders' questions under Standing Order 29. Deputy Micheál Martin, please.
Thank you, John. I appreciate the opportunity to give questions. Talk about that later. Last Thursday, Taoiseach, at the Public Accounts meeting, 3 memos dating March and July 2016 revealed that the Cervical Check management team, the leadership of the HSE, the Acute Hospitals Division of the Department of Health and the Chief Medical Officer all shared and discussed memos relating to the cervical check cancer screening audit and decisions around communicating to treating clinicians and not directly to the women concerned. And what was noticeable in these memos was the absence of prioritisation of the needs of the women and their families and communicating with them, and particularly the families of women who had died from cervical cancer. The memos reveal a mindset focused on managing the risk to the programme itself, of the potential negative media repercussions, and not on the needs of the women and families. They are not simply prioritised in those memos, and they reveal a policy of containment and concealment. Now, Minister Harris became aware, he says, on April the 16th via memo in relation to the Vicky Phelan case. And what I have to say, and I regret saying, there has been an absence of political leadership in the department since then. I can't understand why the Minister wouldn't have summoned people to his department on that issue there and then and said, I want all documentation pertaining to this issue produced within 48 hours, and then I will make it public. And that didn't happen. And as a result, as we know, the Ministers and Government apparently are caught unawares by the Public Accounts Committee's revelations. That reflects a lack of strong leadership and management of the issue within the department itself. Now, Emma Vic Fahuna's public interviews, particularly last Thursday and on the Late Late, and the interviews of other families caught up in this terrible scandal have captured the hearts of the Irish people. People are saddened, they are angry, in some instances confused in terms of the entire scandal itself. And people, Taoiseach, require political leadership on this. The Department of Health statement on Thursday night leaves many questions unanswered, and we need further clarity, and I understand there will be further documentation published and released today. I just have some basic questions to put to you, Taoiseach, that we can get some answers on the record on. Did the Chief Medical Officer and the acute hospital personnel in the Acute Hospitals Division ever discuss these issues with the Secretary-General of the Department at the time, or with you when you were Minister, or with Minister Harris during his time as Minister? Did the Chief Medical Officer or personnel in the Acute Hospital Division ever bring the issue of the audit and communicating the audit to the attention of the Management Committee of the Department of Health by way of discussion or alerting people to it during management meetings in the presence of the Minister or indeed the Secretary-General? And were you as Minister or Minister Harris ever briefed by the Cervical Check management team on the progress of the screening programme? And were any issues at such meetings or briefings ever raised with you concerning the laboratories, the testing regime, or any concerns that they might have had in the conduct of such briefings or meetings with you if such meetings occurred?
Thank you, Taoiseach.
Taoiseach, when you said no and no, do I take it then that Cervical Check as an organisation never met either you or Minister Harris in 4 years? You might just clarify, that's the question I'm asking you. Because it would be kind of normal for a significant screening programme to either on an annual basis or whatever just brief the Minister on the progress of the programme. So you seem to be saying that didn't happen. There was never a meeting between Cervical Check and the Minister. And the reason I ask these questions, Taoiseach, is I do find it very difficult to comprehend why the Acute Hospitals Division, it's a big division within the department up to CISSEC level, or the CMO, did not discuss this issue with anyone else in the department. I mean discuss, no. I'm not talking about the sharing of documents. I'm talking about discuss it with the Secretary-General or with anybody else. Because given the reference in the 3 memos to adverse publicity of the kind the screening programme did not detect my cancer, that kind of thing one would expect would be alerted to a Secretary-General in a department.
Thank you, Deputy.
And to the Minister, in the understandable expectation that the Minister might someday have to respond to a public debate around that very issue. It is extraordinary in my view. I'm not casting aspersions anywhere here, just simply stating the obvious. It is quite extraordinary that the acute hospital did not alert the Secretary-General or the Minister, or it was never discussed at a management meeting of the department, given the clear implications, as we now know, about the revelations of this kind of thing and the absence of non-disclosure.